They say health is wealth. I think after the pandemic, none of us can choose to take those words lightly. Welcome to the healthsite.com Health Summit. My name is Priyanka Sharma, and through this endeavor, we'll try and answer all your queries related to healthcare. We'll tackle 3 different subjects in this special summit. We'll talk about the state of healthcare infrastructure in India. Remember, this is an election year. We want to know where are the strengths and where are the weaknesses, what can be done to make India competitive at a global stage when it comes to offering premium healthcare to its citizens. We'll also talk about the role of artificial intelligence in healthcare. Remember, chat, GPT, AI, these are all buzzwords that are part of our lives and a big part of our future. Can AI be used in healthcare to save lives, to transform lives? What are the ethical concerns? We'll try and get into all of that with our special panel of experts, doctors from different sectors and fields. And finally, a topic which is very close to my heart, women and healthcare. The topic of women healthcare is such a taboo. Even in this century, we don't have enough access to healthcare. There is not enough awareness. And I hope to change all that through this Health Site Summit. So as we go into the different sessions, we'll have different panels of doctors from different fields to answer all your queries, shed light on topics that are not spoken about. So let's get started. Let me now introduce our chief guest in this very special session, Dr. K. Srinath Reddy. He is the founder, president, Public Health Foundation of India. He has also headed the Department of Cardiology at AIIMS. He has been a researcher, a teacher, a policy enabler and advocate, and also an activist who has worked to promote very special causes, cardiovascular health, tobacco control, chronic disease prevention, and healthy living across the lifespan. Welcome, Dr. Reddy, to this very special summit.
Greetings. It's a pleasure to be part of this conversation on India's health journey and look at how best we can actually build upon what we have already accomplished. Indeed, it's a very commendable achievement that India's life expectancy has increased from independence when it was 32 years to 70.8 years in 2023. We are just a little short of the global average of 73 years. However, the healthy life expectancy, which means the years of life lived without any disability from disease or injury, is still about 60 years in India. So there is still a 10-year gap between our overall life expectancy and healthy life expectancy. And we need to bridge this gap if we want to really build upon our productive resources of our population. At the same time, assure people that they can indeed lead long and fulfilling lives free of disease and disability. For this, we need to look at universal health coverage as the principal vehicle for providing a broad range of health protection and health services which are restorative when somebody falls ill. We know that UHC is something that India has committed to in the National Health Policy of 2017 and even in the Sustainable Development Goals, which we have subscribed to. Universal health coverage is a very important goal and a target. So we recognize that even from the COVID experience, that unless you have an efficient, equitable, and empathetic health system functioning well in the steady state, even without a public health emergency, we cannot generate a strong, swift, and sustained surge response when we are faced with a public health emergency. These lessons have been fully assimilated now in our health planning. We have indeed, even before COVID, set in motion Ayushman Bharat with two major components, one of health and wellness centers for comprehensive primary health care, moving away from selective primary care, which was very incomplete and did not address 85% of the health problems faced by the population at the community level. We have now embraced the idea of comprehensive primary health care, covering virtually all important health conditions. At the same time, we recognize that such care has to be continuous, has to provide chronic and acute care, and has to be connected bidirectionally to higher levels of care, that is secondary and tertiary care. And as care gets a little more technologically advanced and more expensive at the secondary and tertiary care levels, the Pradhan Mantri Jana Arogya Yojana has now started providing financial protection to 40% of the population who are financially or socially vulnerable, so that they do not suffer the hardship of hospitalized care when needed. But we also recognize that there are several gaps in our health system. And to bridge them, the other two components have been added now, which is the health infrastructure mission, which is not only to provide much more robust and widespread healthcare infrastructure for providing care for disorders in institutionalized settings, but also a very strong surveillance system to predict and protect against potential pandemic threats. We are also now building a much more competent, multi-layered, multi-skilled health workforce. We have now added the National Digital Health Mission to the Ayushman Bharat complex, so that we are now taking full advantage of our growing strength in digital technologies in order to provide healthcare at home or close to home, providing a wide variety of services like telehealth services, but also at the same time improving efficiency of our systems through electronic health records, better management of supply chains, and ensuring that digital technologies can provide a wide variety of opportunities for self-care, assisted care, and so on. Also, we recognize that it's not merely the physical attributes of a person who is ailing, but also the social and environmental attributes of the community in which he or she is living, which determine the health status. So in order to assemble all of that information, we depend upon big data from multiple sources, and artificial intelligence can help us both assemble and evaluate the nature of the problem from all dimensions. And therefore, we are now looking at diagnostic algorithms, management algorithms, which are generated by artificial intelligence, with the caveat, of course, that context is very important, and much of this data has to be generated in our own settings rather than depend upon artificial intelligence-led algorithms developed in the West, which may not necessarily be relevant to our particular population or disease profile. But digital health is advancing very rapidly, and therefore the four components of Ayushman Bharat are now coming together very well in order to really provide us an opportunity to build universal health coverage on all the four wheels. But at the same time, we recognize that there are groups of people who are more vulnerable or who have been less well assisted in terms of health services. Women's health, unfortunately, has been relatively neglected, because even when we had a variety of programs directed at women's health, it was mostly at reproductive health. It was at maternal and child health, which essentially looked at women only during the period of pregnancy or immediately after delivery. We recognize that a woman faces multiple health problems all across a long life course, including a variety of non-communicable diseases from hypertension and stroke to diabetes, cancers, and mental health issues. And unless we really attend to women's health much more seriously, taking into account all of the health problems that a woman can face during the life course, we'll be doing injustice indeed. We also recognize that unfortunately, women in general, for a variety of social and economic reasons, have had access and affordability barriers to seeking health care. So our health system must particularly ensure that women are not disadvantaged in getting the health services they need at any time in their life course. In order to bring all of this information together for a forward-looking strategy of building a much better health system, this particular conclave is going to be very useful. I'm very happy that all of these elements are being addressed in terms of how we can actually build a better health system, particularly one which has primary care as a strong foundational basis, but with advanced care facilities also closely linked. At the same time, taking full advantage of digital health technologies, including artificial intelligence, but ensuring that all vulnerable sections of our society are well served, especially women. I wish the conclave the very best of success.
Thank you, Dr. Reddy, for your valuable insights. It was a pleasure to have you here. Thank you so much for joining us. Hello and welcome. This is the first session of the healthsite.com Health Summit, and today we'll be talking about the role of artificial intelligence in healthcare. Let's not lie, artificial intelligence has become a buzzword of this generation, be it the use of AI in education, real estate, logistics. AI is everywhere. In fact, we often worry, is AI coming for our jobs? But what happens when you deploy AI in healthcare? Joining me on this very special session is Dr. Vikas Goswami. He is Director, Medical Oncology, Max Hospital, Vaishali, Patparganj and Noida. Welcome, Dr. Goswami. Tell us about what is the role of AI in healthcare in your practice.
So, artificial intelligence is revolutionizing the whole world, and healthcare is also one of the fields where we are really looking forward to it. And there are the applications are immense. Having said that, everything is in the development work, in the pipeline. It's not that AI has literally changed the practice on the ground, but we are hearing and we are listening so many things which are being developed around AI. And I think in the next 6 months to 1 year, we'll see the ground level change in AI in healthcare.
What are the limitations of AI in healthcare?
Look, ethical concerns are there everywhere. Considering the benefit versus the ethics part, I think it's a no-brainer. AI has to come into healthcare. If I say from an ethics point of view, the standard things which are applicable to other fields are also applicable here. Namely, number one is the data privacy of the patients. There are concerns about since AI being a algorithm based treatment, the nuances of the treatment which require a human mind, human intervention. Those are the concerns which are there. But like I said, the kind of benefits which healthcare can see from incorporation of healthcare, whether into diagnostics or treatment or patient communication or access of healthcare to everybody around. I think it's a debate, it's a right question, but with the proper checks and balances, AI has to be the way forward for healthcare.
A very important concern when it comes to the use of AI or any kind of technology in healthcare is data privacy. Do you think the patient's identity is protected when we use AI in healthcare?
See, how I see it is, though, like I said, ground level things have yet to move. Now, imagine a patient who already has his bank accounts, his insurance online, and imagine his health records are also online. And now imagine a scenario whereby all the data is integrated and assimilated with the very fast help of AI. So there can be far-reaching ramifications for the patient, for the family. So I think privacy is the word to go. Let's presume, for example, somebody has a breast cancer. Some lady has a breast cancer, and she also has a gene which predisposes her for familial transmission of breast cancer. By that I mean that she has a gene by which there is a possibility that her future generations will also have breast cancer. Now, if this kind of data privacy is not there, and with the very fast assimilating tools, if this kind of information is clubbed with his insurances, let's presume this information is there with her employers, the patient can have problems in terms of maybe his insurance cover goes up, maybe she has problems in future employment. So like I said, integration is fine, but privacy is the word to go for ethical concerns. We have to develop check and balances.
What are the advantages and disadvantages of using AI in healthcare?
So, good thing certainly is that it is going to revolutionize, number one, diagnostics. Whether it is reading of MRIs, reading of pathological reports, it is going to certainly revolutionize development and research work in healthcare. Currently, the drugs development takes years. With assimilation of AI, that period can be reduced to months. We can have a much faster drug development. Then the good thing is we can have personalized treatments. Right now, most of the drugs are generalized for everybody. For example, if you have a headache, everybody will be given the same kind of drugs. Then even integration of AI into robotics and robotic surgeries with AI, they can be much faster and more precise. So then access of patients to healthcare. For example, so many questions of patients are routine and they feel that they are not being answered. If AI programs are able to automate such kind of communications for the patient, so access to healthcare. Imagine a doctor sitting in India and he's able to operate in a patient in Africa. So accessibility of healthcare with incorporation of AI and internet, of course. So these are the good things. The good one word is it's going to revolutionize healthcare. Bad thing, it should be a tool for human intervention. It should not be the doctor itself. So over reliance on AI can lead to sometimes wrong treatments, wrong diagnosis. So it should always be superseded by human interventions and doctors.
I think another big question is, can AI help save lives? Have you seen that firsthand?
Personal experience of AI actually saving lives. So as doctors who are practicing, I am a cancer specialist. So access to data and assimilation of data is much faster now. If I have to retrieve any kind of information about a disease or any latest developments, then it's in my phone. I just have to use the latest AI tools and I am able to figure out what are the latest developments happening anywhere in the world. So it is changing in terms of so it is a tool for us for patients' health. It is a tool for students. We are able to take the students are able to access medical knowledge much faster. So these are the ground level changes for now.
Is there enough awareness in the country about using artificial intelligence so that we can reap the benefits of this technology?
Awareness is there in the big cities, in the metros. People from smaller towns are not at all aware of any kind of developments. But to reap the benefit, like I said, the development of technology and AI has to come to ground level. We will see these changes in the next 6 to 12 months. As of now, it is not there.
Right, Dr. Goswami, thank you so much for your time.
Thank you, Priyanka. Thank you.
Hello and welcome. You're watching the second session of the healthsite.com Health Summit. My name is Priyanka Sharma and today we'll be talking about the state of health infrastructure in India, a very important topic. Remember, we can only judge the economic health of a country if its health infrastructure is robust and strong. And to discuss that and how we can achieve that, joining me are two doctors. Let me introduce them now. On this session, joining me is Dr. Shafiq Ahmed. He's Director, Urology, Andrology, and Renal Transplant at BLK-MAX. Also joining me is Dr. Sunil Kohli, Professor, Department of Medicine at the Hamdard Institute of Medical Science and Research in New Delhi. Welcome, doctors, to this special panel. So, this is, as we all know, a session on infrastructure, health infrastructure. I think something that the pandemic has taught all of us is that we cannot be complacent about the backbone of our health infrastructure. And the need of the hour is to have robust health infrastructure for a country to progress. And to discuss that, that is why we are all sitting down today. Dr. Kohli, I'll take my first question from you. Tell me a little bit, in your experience, how would you rate the country's health infrastructure at this point in time?
I think we've made great progress in infrastructure over the last few years, especially I think during the COVID pandemic, our healthcare infrastructure did improve by leaps and bounds. Both the private sector and the public sector pulled up their socks, improved their processes. We improved our manufacturing from a nation which did not produce any PPE. We used to import every PPE. We became net exporters of PPE. We started producing medical equipment. So I think the healthcare infrastructure has really grown, and plus I think the Ayushman Bharat, or the digital health mission, that's also contributed phenomenally to the healthcare services that we provide. Uh, Database services have improved. Our databases have improved. Our health monitoring has improved. The government is doing a fair amount of monitoring. Our vaccination processes have improved. So I think the government has brought out new portals. There is a even portal for vaccination. There is another portal to monitor maternal and child health. So there are multiple, you could say, forays into different parts of healthcare that the government has made, and plus, I think the private sector itself has contributed tremendously to the progress of healthcare in India.
Right, thanks for that. Dr. Kohli, coming to you now. Dr. Ahmed, today we're talking about health infrastructure in India. Taking the lessons that we've learned from the pandemic, Dr. Kohli spoke about the strengths. Where do you see the weaknesses as of now in the infrastructure of the country?
Yeah, because we, as a huge nation, we have the limited resources, and there is a limited access and equity to the healthcare facilities across the country. This could be due to the uneven distributions of our infrastructure, healthcare policies as well, and geographical territory is like that it is impossible for the government to deliver with the equal resources at all the corners of the country. So the disease burden we see all across the countries is also in such a way that whether it is a communicable disease or non-communicable diseases, the burden is uneven in different part of the country. So to generalize and deliver in one sort of things is next to the impossible. And the health finances, I would say that majority of our these health expenditures goes out of the pocket. Maybe the awareness among the public regarding the health insurances are not that much. So I think, yeah, these are few things, whether it is we point out whether the geographical or territorial differences across the country, because we are a huge nation and a huge country, that probably leads to the limitations to have an ideal healthcare delivery system across the country.
Right. Dr. Kohli, we often talk about India being a global superpower, India's role at the global stage. When we talk about our health infrastructure, do you think it's globally competitive?
Uh, some parts yes, some parts no. I think a private sector can actually rival, the global healthcare players. We have a very robust, you could say, private sector, and I can say that uh, about 58% of the hospitals and about 81% of the doctors, as per a particular study, are in the private sector. And some of our private hospitals and large hospital chains are world class. And we see a lot of patients coming from outside the country to take uh, our healthcare facilities. And I think our doctors are among the best. We see a huge number of patients, and I think our clinical capabilities and our surgical capabilities rival the best in the world. As a matter of fact, there was a study in the US which said that Indian doctors did provide the best services. So I think we do. But that said, I think we are among the poorest in terms of spending on healthcare, in terms of percentage GDP. The estimates range from between 2.5 to 3.5% of the GDP. And I think we should be around 6% or more of GDP in terms of spending on healthcare, and our GDP is much lower than that of uh, other countries. So I think that's where we lack. I think the government needs to put in a little more money in terms of healthcare. Provide. I think the Ayushman Bharat card or the Ayushman card is taking care of some of that, but that's you could say a little more than a drop in the ocean.
Yeah, that's a very interesting point. A little more than a drop in the ocean. You're saying, Dr. Shafiq Ahmed, what's your view on the same, just the same question that I asked Dr. Kohli? Do you think there's enough spending happening in health infrastructure?
Not really. I agree with Mr. Sunil Kohli that we are not, spending enough of on the healthcare system compared to the other countries. If to mention few, but as a huge nation, we probably have to keep a balance between all those issues, and that those are the government policies. We are already having some Ayushman healthcare system in place to help the poor population to get the access to the healthcare. But I do feel and agree that we must have to spend more when it comes to the health budget if we had to really uplift.
Right, I think there's some internet issue there with Dr. Shafiq Ahmed's connectivity. Dr. Kohli, I'd like to take another question from you. When we talk about equitable healthcare, are we doing enough to bridge the gap when it comes to access to healthcare between rural and urban areas?
Well,
The rural-urban divide, so to speak.
I think that's a very good question. Majority of our private sector healthcare facilities, which are actually among the best, and the larger government hospitals are in urban areas. The rural areas are catered to by primary health centers and maybe a little higher the CHCs. But that said, the primary health centers are good, but I think we need to boost up the infrastructure at district hospitals and at sub-district hospitals. They need to have a little more tertiary care facilities. At the moment, I think they only offer primary or a little more than primary care, maybe just about managed secondary care facility. They may have the basic, uh, you could say, secondary care specialties like medicine or surgery, but they don't offer anything more than that. And they too are understaffed because majority of the good infrastructure is in urban areas. So I think we need to do a lot more in terms of uh, primary care centers and improving primary care centers and district and sub-district hospitals. Even in Delhi, uh, there are some government hospitals are good, but the other sub-district hospitals are actually in you could say a fairly poor state. So you can imagine what the state would be in rural India. So that said, there are certain states which do very well. Kerala always remains on top. UP, Bihar, unfortunately, come down lower down the list and usually top the bottom, you could say. Uh, but that said, I think we are slowly getting to it. India is improving, and I think hopefully in our lifetime we shall see some progress.
Yeah. Yeah, that's definitely all our hopes. We have Dr. Shafiq Ahmed back with us. Doctor, what are your expectations or rather concerns from the Ayushman Bharat Digital Health Mission?
Well, it's okay. I mean, we see there are downtrodden section of the population are getting advantage of Ayushman Bharat. But let me put it this way, that unless until we do not eradicate the basic health disease burden from the community, and just simply having some schemes with the limited whatever resources what we have already, probably will put more and more burden on the healthcare infrastructure as well. So, to my mind, it's not only the healthcare structure or infrastructure means that providing the medicines and equipments and the main force, but we had to go to the basics where we need to take care of the nutrition, the food security of our population, to eradicate the diseases at the very ground level, for the doing the immunizations, and involving the community, and the role of the community, spreading the education, and dealing with the environmental risk factors, so that we can curb the disease burden right at the beginning. So for this, obviously, you need to have the schemes in plan, the policies in plan, and those policies has to be implemented with great precautions and accuracy, which is the need of the hour. Probably, only if we look all across the world, only those countries could have given the equal chances of health care to their population, who have implemented their policy strictly. So we need to go to the ground level, not only providing the doctors and nurses will probably are making our buildings will actually is going to help and improve our infrastructure, healthcare system. No, we have to look to the disease burden, epidemiology of the diseases, and curb at the community level. Then we can say, yes, we are providing the better healthcare to our population.
Right. Dr. Kohli, you spoke about private spending, the private sector playing a huge role when it comes to having a robust healthcare infrastructure in India. Let's talk about the economic health of the country being closely linked to how powerful and strong its health infrastructure is. Uh, Tell us the significance of having a robust health infrastructure and how it correlates to India's economic health as well.
That is a wonderful question, actually. Uh, because I was reading up a little on how healthcare improves economies, and I remember reading some time ago that we should make health a key part of our economic growth discussions, because historically, better health in countries has been related to better economic growth. Improved healthcare, you know, can actually contribute to almost a third of the overall GDP growth in a country. And there are some research estimates that say that better health could contribute about 12 trillion to the world economy, to the global GDP, by possibly the next 2.5 decades, and that's approximately an 8% boost of the economy. So you can when you have a healthier population, you have a longer working workforce, you have lesser days off, you have lesser expenditure on you could say uh, treatment or curative function. So we must look at improving health, improving preventive care services, improving public health services, and that will contribute at least, I think, between 6 to 8% to our GDP growth by spending that little extra 3% of GDP on healthcare might boost our economy by about 8% or more.
Yes, let's hope that happens actually, because those are very interesting figures that you've just mentioned. Let's talk about technology, Doctor. We also had a session earlier on the role of AI in healthcare. I don't think we can talk about health infrastructure without talking about digital infrastructure and boosting it. It is the future, a digital future. India is doing everything it can to be a digital economy. That's one of the government's primary goals. Do you think there's enough awareness about how technology is being used in healthcare? And what's the flip side, according to you?
Actually, I think COVID. the COVID years were great to develop technology in healthcare. So telehealth, telemedicine, telehealth consultations. I mean, I think most of us, all of us, actually, all doctors did teleconsultations. I'm sure you would have also been one of the beneficiaries of teleconsultation
Absolutely.
during the COVID time because nobody went to hospitals except for emergencies or getting admitted for COVID. So telehealth allows doctors to diagnose, to treat, and oversee patient care virtually, without patient actually coming to their clinic. So you can have telemedicine kiosks in different places. So I can now provide my services to somebody sitting in a rural area, and there could only be maybe a health assistant there who records the ECG, transmits it to me, who can put in a stethoscope at the place that I want and transmit it to me. You could have actually tele ultrasounds, even though that's not really permitted in India because ultrasound is a very tricky subject in India. But that said, it includes cost savings, improved access to healthcare for people who are you could say geographically challenged and people with mobility issues. So there are risks such as gaps in care, the overuse of medical services, and limitations because you sometimes need to perform a physical examination. But that said, it improves. And then you have the scope of digital therapeutics. You did speak to another doctor about AI in healthcare, and computational approaches and AI have also improved. I mean, you have edge detection technologies and AI in X-rays, which can detect diseases much faster. And of course, the Ayushman Bharat Digital Health Mission has, provided a digital registry where we will actually have a huge database coming in, which we could then exploit with AI and maybe generate new knowledge uh, in the sense. So I think technology is very, very useful. And you've, of course, got newer equipment, you've got continuous glucose monitoring, you've got newer monitoring technologies, you can remotely monitor a patient. I can monitor the blood sugar of a patient sitting in Bihar. That goes through the cloud and comes to me on a real time basis. So that's technology is great in that respect, and I think we should embrace it.
Absolutely. Dr. Ahmed, the same question from you. How have you seen the role of technology change in the last few years in your practice?
Oh, extremely. I mean, I think I was trained in the era where the open surgery was most major part of the treatment delivery and surgical patients. But now, over the years, we have progressed through the laparoscopy to the robotic surgeries, the lasers, the minimal access from all the sites. Now the artificial intelligence are in as well. So we, as a globally, have really progressed at a new height to deliver the best of care to our patients. But all these things are it comes at a price, at a cost. Not everybody is accessible to all those. We as Indians should must be proud that we are becoming the hub of medical tourism. All across the world, patients are traveling to India to get the best of their healthcare treatments, because we are giving them the best of the treatment at a very cheaper cost. But this model we had to carry forward for all our population all across the country. And I'm sure the government is on the mission. We have already national this medical mission is already there. We have rural missions, health missions, we have urban health missions already there in place. We have a telemedicines which is already there. The doctor sitting in Delhi can definitely help his colleague somewhere in a remote area to read the ECG and pick up the patients with the cardiac issues to get treated, as doctor was telling about, that he can see the blood sugar or whatever treatment. So the public private partnership, another very good aspect.
Right. Uh, I think we'll get Dr. Shafiq back.
If I may add, teleradiology is very much there, and of course, even telesurgery. Dr. Shah did mention about robotic surgery. So I think it was way back, maybe about 20 years ago, during one of my army courses, I did write a paper on this subject on using telesurgery by a surgeon sitting in a remote area, but using a robotic platform, in the forward areas to operate upon casualties in the army. So this was a concept that came in maybe 25 years ago, and it's now actually a reality. Dr. Shafiq can actually operate upon a patient robotically, communicating via the internet with a robot elsewhere, uh, and operate in a surgery that is miles away from him.
Right. That's actually very fascinating. I think to all the people watching this, patients, and even aspiring medical students, I think they'll know that the future is extremely exciting and bright. We're going to wrap up our conversation. I'll take the same question to both of you. You first, Dr. Kohli. It is an election year. It's a crucial year for the country. Lots of changes are expected. If there's one area in healthcare which you think needs immediate attention, what would that be?
One, of course, is improving our hospital infrastructure and equipment infrastructure. Even the Supreme Court, I think, or the Delhi High Court has taken notice of the poor infrastructure in government hospital in Delhi. They have no MRI machines which work, or they have very few MRI machines for the whole lot of them. So I think we need to spend more on our medical infrastructure. We need to increase the spending on healthcare. I think, period. I think that's one thing I would say. If you were to take it, increase spending, government spending on healthcare and on
Right.
public health engineering.
Absolutely. Increased spending on healthcare. That's going to be my takeaway from you. Taking the same question from you, Dr. Shafiq Ahmed, what's your one wish list? On your wish list, what's that one area that needs immediate attention? As I mentioned, this is an election year.
Increase the health budget. That's the only thing which will, take the solution of all the problems. Unless until we do not spend, we should not expect that we can provide a good health care at our peripheral rural areas. Let's not talk that what we are getting in Delhi. Let's talk that what we are getting in a remotest area of the country. They need those attention what the person is able to get attention in Delhi. So spending on the healthcare, is the need of the time. And of course, we had to go to the ground level and to curb the environmental risk factor for the diseases, and to uplift the nutritional value, nutritional support to our those who cannot afford that, to get the problem sorted out at the ground level.
Absolutely. Doctors, thank you so much. Lots of valuable insights that I'll take with me. A lot of big improvements in India's healthcare infrastructure, but nearly not enough. We still have a long way to go to be a globally competitive country when it comes to securing the health of our citizens. But even so, the future does look exciting and promising. And on that note, I'd like to wrap up this session. Thank you so much for your time, Dr.
Thank you.
Sunil Kohli and Dr. Shafiq Ahmed. It's been a pleasure.
Thank you, Priyanka, and thank you, Dr. Shafiq. It was a pleasure being on the same panel with you. Thank you.
Same here, Dr. Sunil Kohli. Pleasure seeing you on the. Thank you.
Next up, let me introduce our guest of honor, Dr. R.V. Asokan, the National President, Indian Medical Association. Dr. Asokan has served as a member of STAG in the WHO Geneva. He was also the National Secretary of EMA, Hospital Board of India, for 4 years, and was also its chairman for the past 4 years. Welcome, Dr. Asokan, to this summit.
Universal healthcare has been a dream. Universal healthcare for every Indian will not arrive unless the investment in health by both the central as well as the state governments is increased to at least 5%. It has to increase to a level where the governments are able to be the main player. Today, the governments are not the main player. Out of the 4% of the GDP that is being spent on health, 1.1 to 1.6% comes from all the governments together. What it means is that out of 10 lakh crores of money, 2.5 lakhs of crores come from the governments. and 7.5 lakhs of those come from the private sector. This actually has to be reversed. Governments traditionally have not prioritized health. Health has never been a priority in our elections. And health, if it is prioritized, actually there are studies which show that investment in health returns in a high bonus in our GDP increase. So the government investment in public hospitals, public infrastructure, public human resources is the only means to prioritize health. And the GDP of 1.1 by the governments is too low to produce any result on the ground. And the healthcare structure that we would advocate, the medical fraternity of India, represented the Indian Medical Association, we recommend a tax-funded model with a basic package for every citizen of India in primary care, secondary care, and tertiary care. The current flow towards the insurance model is not acceptable to Indian Medical Association. Insurance is bound to be incomplete in its coverage and suboptimal in its penetration. It is not going to serve the entire nation. The government has to start a tax-funded model with a basic package for everyone and strategic purchase from the private sector for those services which are beyond for the common people. So the insurance model will leave us all in a situation where United States is today. In spite of plowing in 15% of a huge trillions of economy, 20% of the American citizens do not get a proper health care. We don't think a country like India should go in for opt out for an insurance model, including the Ayushman Bharat. We need to go in for a model where there is a tax fund. Even in Ayushman Bharat, we have suggestions that it should be re-envisioned that government hospitals should be directly funded. And funding it through Ayushman Bharat, providing 66% of the care through government hospitals where the care is even otherwise free, does not make any change. 5 crores of Indians go below poverty line every year because of catastrophic health expenditure. And 63% of it is due to out-of-pocket expenditure. A major share, 2/3 of the out-of-pocket expenditure is due to outpatient expenditure. And even amongst that, the major share is going to the drugs. None of the insurance covers the outpatient expenditure or the expenditures incurred during outpatient care. That is why a universal healthcare model should be based on a tax-funded model covering primary care, covering outpatient care, covering the drugs part during the outpatient care. Otherwise, it will not make any change in the out-of-pocket expenditure, the catastrophic expenditure on health, neither on the number of Indians who go below the poverty line. So, we would prefer a tax-funded model, the basic package for everyone in primary care, secondary care, and tertiary care, and strategic purchase from the private sector. I am grateful to the health site part of the media for having invited me in this 4th seminar that is being held on webinar. Thank you for inviting me to this webinar.
Thank you, Dr. Asokan, for joining us today. You have really simplified things today for all of us and given us valuable insights. Thank you so much. Communities and countries, in fact, the world is only as strong as the health of their women. Unfortunately, these are not my wise words, but those of another woman. I'm talking about Michelle Obama. But these words ring true, especially in today's world where women's health as a topic is still a big taboo. It's still not spoken about nearly enough, I feel. Let me name some terms which all of you are familiar with, I hope. PCOS, cervical cancer, breast cancer, menopause, postpartum depression. Now, these are just some medical terms for a lot of people, but for many women, some within your homes, my home, for some of them, these are the bitter realities of their lives, and yet they don't talk about it enough. Why is that? Why is women's health still not spoken about enough? What can we do to make women's health mainstream? Well, we can start by creating awareness, and that's what I hope to do through this special session of the healthsite.com Health Summit, exclusively dedicated to women's health. This topic is very close to my heart. But I'm not alone in this. I have an esteemed panel of doctors with me today who will help shed light on women's health, the different mysteries that surround it. Let me now introduce them to all of you. I'll start with Dr. Shafiq Ahmed. He's the Director, Urology, Andrology and Renal Transplant at BLK-MAX. We also have in this session with us today Dr. Tapaswini Pradhan. She's a surgical oncologist at the Indraprastha Apollo Hospitals. And finally, we have Dr. Rahul Chandhok. He's a senior consultant and HOD psychiatry at Artemis Hospitals in Gurgaon. I welcome all of you to this special session. Thank you. Right, Dr. Tapaswini, I want to start with you. You know, the dreaded C word, cancer. I think we all know someone who's battling some form of cancer today. When it comes to women, in your experience of many, many years, what are some of the most common forms of cancer? And the natural follow-up question would be, what can we do in this day and age to prevent them?
Globally, if we see, the most common cancer which we get to diagnose is the breast cancer. But then if we consider overall, so breast cancer ranks the highest all over the world. And then we have the colorectal, lung cancer, cervical cancer, ovarian cancer, endometrial cancer, and skin cancer. But we are talking with relevance to our country. So the urban population most commonly sees breast cancer as the commonest, and the rural has the cervical cancer. The other cancers which are very common in women are also oral cavity cancers and esophageal cancers. Now, if you ask me as to why and how we can prevent, one of the main factor in all these cancer is our lifestyle, which has changed dramatically over the years. And besides lifestyle, also our habits. And the other thing in medical sector, we're finding that the life expectancy of people has also increased over the years. So I feel these are the three contributory factors. We can talk at it, at length, contributory factors as to why we are seeing a rising incidence of cancers, especially in women.
Thanks for that, Doctor. Coming to you, Dr. Chandhok, cancer and mental health, somehow they're related in a lot of ways. When we talk to somebody suffering from cancer or when we talk to their family members, it's a miserable journey. And I think in today's time, mental health has come to the forefront when we talk about tackling our lifestyle challenges, our daily problems. And mental health challenges are being faced by not just women, but young girls. So my question to you is, what are some of the common challenges in your experience for young girls, adolescents, and then older women?
So we have to understand that when we talk about mental health and from the perspective of a mental health professional, what we say is you treat a patient, you heal a family. The impact of mental health issues is so broad that not only the person who is suffering from mental health issues undergoes pain, the entire family undergoes it. So when we talk about adolescents' mental health, we have to understand that adolescents basically are in a transitory phase. Their personality is developing and they are undergoing changes in so many aspects of their life. Okay, so they are basically looking forward to their own identity. They are discovering their sexual identity. That some people are thinking about gender, and not only that, they are fiercely trying to become independent. They want to have their own opinion, and they just do not accept anything on the face of it. With the advent of social media, they have information on their tips, which leads to a situation where they are constantly questioning whatever is being told to them, which leads to pretty dynamic situations regarding mental health in the households. So, because of this transition, a lot of mental health issues crop up. It could be anxiety, it could be depression, it could be personality issues, it could be substance abuse, which a lot of teenagers resort to, maybe under peer pressure, maybe to look as a solution for their own anxieties. But a lot of these things are happening because of their urge for the experimentation. So this is how adolescent goes through. As far as young women are concerned, you see they are juggling so many things at the same time. If their studies are over, then they are working, managing their own independent life, which leads to a lot of stress, which can lead to anxiety and depression.
Dr. Chandhok, you mentioned some very important terms, social media and peer pressure. I want to pick your brain on that a little bit later. Coming to you, Dr. Shafiq Ahmed, you're the Director Urology at BLK-MAX. Tell me about, in your practice, what are some of the common urological complaints that women come to you with, and can they be prevented or at least caught early on?
So as a urologist, I see all the age groups of females in my OPD or outpatient clinic. The most common problem which I encounter in females is lower urinary tract infection, lower urinary tract symptoms. So the common age group of females, which comes as a teenage, the most common with the urinary tract infection, and as well as the old age. The second most common problem is sexually transmitted diseases among the young females. However, the females are not immune to get the other urological problems like genitourinary cancer, whether it is a renal cancer, kidney cancer, or any ureter cancer. Along with that, some of the diseases which are very specific to the females, like related to the prolapse, like vaginal prolapse or uterine prolapse, which we encounter in our day-to-day practice.
Everything that all you doctors have mentioned, there's one word that I find very interesting, and that is awareness and catching things early on, be it cancer, be it mental health issues, or even what Dr. Shafiq Ahmed has now mentioned. Coming to you, Dr. Tapaswini, with cancer, the one common myth is that, it's not easy to prevent. Once you've got it, it's a downhill journey. But is there something that we can do in our daily lifestyle to perhaps prevent cancer? And what are the screening tests that women should be getting regularly so that, God forbid, there is a risk we catch it early on?
Correct. So screening is actually one of the most important aspects in surveillance of, cancer. And this is catching people before they contract the disease. And as we said, breast cancer is the most common. So we should understand that the average lifetime risk of a woman to have breast cancer is around 12.4%. So there are category of patients who are in a high risk also, where they carry a huge, percentage where they can get this disease. Now, how do we screen and when do we screen? So most of the screening protocol says that it should start after the age of 45 years. So patients who are in a bigger risk, like patients who have a very strong family history of breast cancer, or patients who have received mantle radiation or radiation to the chest at a very young age, 10 to 30 years, in that situation, they ask to be screened early. or patients who have had lump which was diagnosed with some atypical hyperplasia. These are the patients which need to be screened much earlier, which means it should start as early as 25 years of age. So screening is done either in the form of mammograms or screening or diagnostic mammograms and the MRIs and the ultrasound. So the other group that we also should talk about is one, people who are nulliparous, don't have children, or who have had late pregnancy, late marriages, consumption of alcohol, and then you have patients who've had early menarche, late menopause, excessive consumption of oral contraceptive pills, or using the HRT, hormonal therapies post-menopause. In all these situations, one should be very careful. These are the patients which need to be screened regularly. But besides that, what's really important for every woman to know is how to do a self-examination of the breast. And that, of course, is something which we should all learn, and we can pick up lumps almost to the tune of around 70 to 80%. So if we know how to examine ourselves, to a great extent, we ourselves, can pick up diseases. But it's very important to know that every lump is not cancer and every lump is not benign. So whenever we feel anything abnormal, we should definitely come and meet a specialist. Now, the other cancer which also needs to be rate-rated is cervical cancer, because you get to see often in the rural population. And that has some connotation with our sexual practices. So multiple partners, or, having a lot of children, or you have had intercourse at a younger age, mother at a very young age, or having sexually transmitted diseases. In these patients, yes, the screening has to start as early as around 21 years of age. Test is very simple. We do a pap smear test. And the other category is who are not at the high risk. So the screening starts as early as 30 years and needs to continue till around 60 years of age. So pap smear and an HPV analysis, which is done because 70 to 80% of the cervical cancers are caused because of human papillomavirus. So if we know all the etiology, I think then we also can figure out as to how we can prevent ourselves from these diseases. So if you remember at the start of my, when we started the discussion, I said most of these diseases are lifestyle based. So we need to change.
Right. Yeah, doctor, those are very important words. In fact, all the women, young girls, their mothers, their fathers watching me right now, I request you to pay heed to what the doctors are saying. Remember, prevention is always better than cure. Our lifestyle needs to change. And I urge all the partners of women to urge them to do a self-examination test, get a pap smear done. Go to your nearby gynecologist, ask what are the tests that need to be done. Science has advanced much more than it had 10 years ago. Now, my next question is to Dr. Chandhok. When we talk about mental health and different transitions or stages of life in a woman's life, be it pregnancy, postpartum depression, menopause, is there enough awareness today that women are armed to deal with all these challenges?
So you see, if we talk about awareness, we can divide things into two parts. Awareness about mental wellness or mental health wellness is one thing, and it is being promoted in a big way, especially post-COVID. It seems that everybody is into improving their mental health wellness. But when we talk about awareness regarding mental health disorders, I think there is a big lacuna there. I think we can put it to the stigma and the taboo that people are still very hesitant to talk about them. Otherwise, I think we are having so many suicides in a place like Kota, where bright students go to study, would not be happening. So I think there is a divergence between what is being promoted as mental health wellness versus the awareness about mental health disorders like anxiety and depression, which can be treated. So these are two very different things. So the awareness about the disorders which need treatment for saving the lives of young kids, saving their careers, saving their studies is, I think, still a long way back.
Very quickly, Dr. Chandhok, talk about social media, because a lot of this has to do with the kind of access we have to the outside world. Social media has opened a new Pandora's box of issues, in my opinion. I have 2 young children, and the constant debate that we have inside our homes is when should they be allowed to have access to social media, given the kind of news that's hitting the world today.
See, the point is that yes, children now have a lot of information at their hands, but they don't know how to regulate it. You see, in my time, we used to read newspapers if we need to be aware. Okay, we need to have general knowledge, or we need to be aware about the current affairs. But now it is much beyond that, and it's very unregulated. So the crucial point is that at what age your children are starting with their media exposure, and secondly, how are you discussing it with them? Are you involved? Do they come to you with their queries that yes, I have read this today, can we discuss it? So if your participation is there, okay, that will take away their curiosity and their need to hide from the elders or adults. So we have to firstly accept it, that it is something which is now a part of our life. We just cannot wish it away. The way the things are, everyone has access to a device where internet is linked. So we cannot just wish it away now. And after the advent of online classes and online coaching, everything has shifted. So firstly, acceptance has to be there. Secondly, we have to start taking it into account that yes, if you have got some information, we are open to discuss it. But what you can search, what kind of information you are going to access, if the children are small, today it is definitely possible for the parents to access their devices till they at least reach the teenage where they start hiding. But if you are in open communication with them, I think, and you are open to discuss things which they are reading up on the net, like just we had a controversy that the CBSE has got a chapter on for class 9 kids, which the CBSE later denied. that was regarding the relationships and social media. But at least we can discuss it at our home. So if we give them that comfort, I think we can tackle the social media evil.
Absolutely. I think having an open channel of communication is a need of the hour. Dr. Shafiq Ahmed, coming to you, I spoke about the advancements in science. When we talk about urology, how far has science come to tackle the present day challenges and illnesses in your practice?
The development which has happened, advancement as per the advancement is concerned in urology in last 2 to 3 decades is extremely high compared to the rest of the subspecialties. The best thing which has happened for the urological patients is the advancement in the robotic surgeries, the laser surgeries to deal with the stones, the robotic surgeries to deal with the cancers of all kinds, whether it's a kidney cancer, bladder cancer, or for that matter, the prostate cancer among the males as well. And another advancement which I believe is the most played a crucial role is the developments of different types of scopes which are being used in the clinics to diagnose and treat the urological problems, whether it is a kidney stones, the bladder stones, or the prostate issues among the males. So when it comes to the female's health, these robotics has really played a huge role for the minimally invasive surgery compared to the open procedures.
Right. My next question is for Dr. Tapaswini. When we talk about awareness, do you think there's enough awareness being created in the country at the moment, especially in urban centers, when it comes to cancer-related queries?
Yeah, of course. The awareness is happening from different quarters, right? From the health professionals to the various NGOs to, students creating awareness through different, media. And also social media is also playing a lot of role in creating awareness. But what I personally feel, we need to put in a lot of more effort so that we reach every nook and corner of the country and every age group to be enlightened. This is a big challenge. And if each one of us puts in effort, and if each one of us understands the gravity of the situation, probably it will be much easier.
Right. Coming to you now, Dr. Chandhok, when it comes to children, especially young girls, is there a lot of pressure because of social media and the kind of generational changes that we are seeing with the advent of new media coming into our daily lives?
Basically, exposure to social media enhances the level of peer pressure which a child or an adolescent goes through. So it is equally for both boys and girls, but because both of them are going through hormonal changes in their adolescence periods, those hormones definitely have a big impact how they perceive and how they react to things. Their personality is developing, they are experimenting with so many things, and they want to have their own worldview. So definitely the kind of information which they gather, whether it is a conflict between smoking a cigarette or vaping, or whether it is experimenting with alcohol. So much is going on in today's adolescent life. It's simply jumping from one experiment to another. So unless and until they are very focused on what they want to do and they have a definite goal in life, definitely they feel they face a lot of challenges.
Let's talk about nutrition now, Dr. Tapaswini. I think nutrition, what we eat, what we put into our bodies, has a lot to do with the kind of illnesses that we are tackling and also how to prevent those illnesses. Do you think today's working woman, when we talk about urban centers, today's working woman is getting enough nutrition from her food? Or is there a strict need for lifestyle supplements, as they call them?
You see, it's in our Indian society, the woman always takes care of the family and puts that as her priority, and she's put to the back end. So the family is fed first, and whatever is remaining is for her. So we need to change this we need to change this psyche of every woman. As Vivekananda said, the thermometer of the progress of the nation is dependent upon the health of a woman. So every working woman, it may be a grade of different physical activity, would require something around 1,800 to 2,400 calories per day. And the distribution should be in terms of energy through carbohydrates and proteins and essential fats and vitamins and minerals. And also, you're undergoing a lot of physiological changes because you may be in different phases of your life. You are a young woman, you are a married woman, then you become a pregnant woman, then you are a mother, and then menopause. So all these phases of life would require your own nutritional requirements, which will be varying from time to time. So it's important that you have knowledge. And when you are working, food becomes something like, it takes a backseat. It's something which is convenient and easily available. So you tend to binge on fast foods, processed foods, or frozen foodstuffs, or something which is very tasty and palatable to get that craving out. But then what we need to focus is on the nutrition. So all these junk foods, they don't give you nutrition, they'll give you instant calories, but the nourishment comes through different types of components that we have in our food. So a healthy diet, of course, has to have a balanced proportion of all these nutrients that we talk: proteins, carbohydrates, vitamins, minerals, and whatnot. So what's said is for a good health, 2/3 of our diet should be rich in vegetables and fruits. So nature abounds. Nature gives us so many colors through our fruits. So if you have to have good health, your internal milieu has to be more towards an alkaline environment, and that you get from a rich consumption of fruits and vegetables. Other than that, calcium. A lot of calcium requirement. Yes. When you are pregnant or even during lactation and also in postmenopausal stage. So osteoporosis is something not very uncommon. So we need to take care of our skeletal system, our bones, so calcium, phosphorus, and various other minerals like magnesium, zinc, iron for that matter. So when you're menstruating or during pregnancy and during lactation, iron is something that we should not forget. So rich sources would be our green leafy vegetables and the various animal products and egg yolks and so on and so forth. So the other is also learn to take meals at regular intervals, never skip meals. So that the fad is to keep thin and look slim and trim, but yes, more than that, you should look healthy. That's more important. So the diet should be your bank account, and a healthy food should be a good investment. That's what I would love to tell all the women, the society.
Right, those are some very interesting points. All right, now before we wrap up this session, I want to take some closing comments from all the doctors, the esteemed panel that we have on this very special session on women's health today. Starting with you, Dr. Tapaswini, if you had to say something to the young women of India today as a doctor, what would that be?
The most important thing is that women are the most important part of our society. And if the nation has to progress, it's the women's health which is most important. So we should all learn to take care of our own selves. And it's then that we can take care of the family, the society. So we should all learn the various tips and tricks to keep ourselves fit and healthy. And with career and the successful career, we can be a successful woman as well. So just don't keep pacing the life. Yeah. So let's not just run in the life's race. We should all learn to take a pause and look into ourselves, introspect, and do our level best. And I think we are the best creations of God.
Right. Thank you for that, Dr. Tapaswini. Coming to you now, Dr. Chandhok, your final comments.
Excellent discussion. I would like to summarize that, yes, along with the physical health, which we all focus on, we need to focus on our mental health also, because without mental health, you won't be able to contribute as much as you wish, either to your career or to your family or to your kids. So mental health is important. But at the same time, if something happens, either you become depressed or anxious, or you feel that you are just not yourself, your behavior is changing, you become agitated, you are not motivated, do consult a mental health professional. Don't hesitate, so that you can be brought back to your normal self.
Thank you for that, Dr. Chandhok. Coming to you now, Dr. Shafiq Ahmed, your final comments when it comes to this session.
Yeah, I would, request all the women out there that you must come up with your all the problems to discuss with your clinicians, especially the young women who have any sexual related issues, sexually transmitted diseases, and the elderly women I have seen suffering in a silent with their urinary issues, whether it's a urinary leakage, stress urinary incontinence, and urine infection. They do not come up till the very late for the treatment. They should not do exactly like that, and they should come up and discuss with their colleagues as well, and as bring them to their clinicians to get the treatment early. I would also mention here that this genitourinary system is one system which is a very private to everyone, especially to the females, and they should take care of their health when it related to the sexual and the urinary issues. Thank you.
Thank you for that, Dr. Ahmed. And I just want to thank all the doctors here on this special session today for being so candid about topics that we don't normally talk about. These are not dining table conversations. And I wish through this session that they become a part of our daily conversation. I implore all young women and the girls watching me right now, their mothers, their fathers watching me right now, to help their daughters understand that their health is paramount for not just themselves, but their family, for the country. And only if we talk about these illnesses, be it mental, physical, physiological, can we tackle them. And on that note, thank you to our doctors who joined us today, gave us their precious time and patience. And with these 3 sessions, I'd like to conclude the healthsite.com Health Summit. This is Priyanka Sharma. Lots of new learnings for all of us, all of the viewers who have watched this on various platforms. I just like to say that take care of your health, get tested. Go to your doctor, go to your gynecologist. Remember, knowledge is power, prevention is always better than cure. We've taken different learnings with us home today, and I'd like to thank all our panelists, a panel of doctors who took out their precious time to sit down with me and talk about different things. Thanks for watching.